Thanks, Caroline. But in particular, I'm delighted to be here today, in particular representing the State Trustees of Australia Foundation, which is a public charitable trust established 20 years ago in 1994. The trust itself has 65 million corpus, which is being derived from generous bequests and donations from Victorians. The strategic focus of the foundation is to help improve the lives of Victorians through ageing, disability and mental health, and I'm really excited by the panel being here today. Also, just in regards to the foundation, we generate around about 2 million of grants per year, and we encourage you all today to actually go to our website, log on first and have a look at our foundation, but also express any interest in potential granting. Whilst I'm here and I'm extremely passionate about the panel, just like to thank the panel, the 7 leading organisations who are currently collaborating, identifying key issues in this time of change. So from the foundation, I'd like to thank the panel itself. Thank you. So it's now probably open to questions. We've got a great panel with great conversations that have been had. So I'd like to open up to the floor with anybody who'd like to raise a question. If not, I can go first. Okay, so anybody can grab this one. So what do these transformational changes mean for rural and regional Victoria? Does choice look different from a CBD based to a regional city?
Yes, very much so. I was in Benalla a couple of weeks ago and was evangelising about the NDIS providing choice and control. And this old bloke down the back basically said, well, that's all very well and good, mate, but we've got 2 providers in this town. Mm. That's what choice means for us, mate. Yeah. And he was rather blunt about it, but I could see his point. I mean, that whole notion of the thin market for disability services is another of the issues that I would argue we need to actually be working with the NDIA and governments to resolve, because it's a pretty critical one.
Mm. And I would support that, certainly, from what we're hearing around the market responding to people in the bush. And even things like in some towns they don't have taxis. So what does transport look like?
Yeah, I'd like to add to that. Down in Barwon, there is one participant that I know of who they live in Torquay, and they don't have service provision in that town. So specifically they have to go to Geelong to get that service. They have to go by taxi, and at this time their taxi funding has ceased, and the NDIA are not providing any more funds for that participant, and they are now being taken to and from their service by their mother. And again, at this time we're trying to fight that. We're going through the process to try and fight it. So hopefully through Kylie's experience, which was traumatic, but we got a very good outcome. The processes that we're going through again, I'm hoping that does make it better for people who are in regional, rural or limited services, that they do actually get what they are entitled to and get good quality service provision as well.
Thank you.
Can I add one there? Look, I was just talking to one of our ethnic communities councils in Wangaratta the other day, and they were saying there are a lot of people from non-English speaking backgrounds who are socially isolated, culturally isolated, geographically isolated, and need a lot of intensive, repeated work to actually get them connected, and our ethnic communities councils manage to do that. However, the council itself in Wangaratta is at risk of not being sustainable with that model. So what happens to the people?
Thank you. We have one question just over there.
Hi, I'm Robin Gale from Daru, the Disability Advocacy Resource Unit. Question for James and Kylie. Do you have any suggestions or recommendations to people with disability or advocates about what you might have been able to do differently so that the situation that led to your plan not being successful, not having to even go to a complaints stage, is there any thoughts or tips that you might have about how that might have been able to be avoided?
Robin, it's James here. I think it's quite difficult just now because the NDIA, they're working under that insurance model, so they're looking for value for money, which is fine, and we understand that. But they won't provide for health, and they won't provide for education. And at this time, we are fighting through the Administrative Appeal Tribunal, through internal reviews, to try and get service for that individual. And sometimes NDIA will say that that service should be provided by the Department of Health. So we have to fight, is it Department of Health, or is it NDIS, or is it both? And sometimes we need to go to the Administrative Appeal Tribunal to get somebody to say yes or no, so that we can then decide if it is health, then it's specifically health. We have to go see the health system and get them to provide the funding. If it sits with NDIS, then they have to help and support that individual.
I know with James there that it is to a degree, because NDIS is so new, it is defining what sits under health and what sits under NDIS.
Thanks, Kylie.
Yeah, Nigel Fidgen from Area Community Health. Firstly, thanks to the panel this afternoon. It's been really informative and a really interesting afternoon, so thank you. Not directed at anyone in particular, I'm just wondering whether the work of the collaborative has given much focus to the issues of workforce. We saw in Victoria what happened to the community-based mental health workforce with the recommissioning process, and I've picked up on comments today where we've touched on words such as market failure, risk of service provision, etc., etc. And I think when we see the change that our workers, our staff are going to be having to operate in a completely different model, where the sort of approach that staff will have to have with a client-directed focus will be very foreign to some staff. And I think there's potentially the risk that some staff who are already fatigued with the rate of reform will just think, this is just too hard, and I'm going to go and smell the roses or something, and the implications for workforce.
Nigel, thank you. That's a gold star question, because I've noticed that just in the last half hour, a lot of people have started pointing out some elephants in the room, and I think that's one of the things that we have, that this panel, it's beyond our scope, but it's also something that's not really being addressed in the public conversation. We believe in mental health, we will see, unless things change significantly over the next couple of months about what the nature of the work is and some threshold issues are dealt with, we'll see some really significant redundancies of highly skilled, very passionate, very capable mental health support workers. And so I don't think we can underestimate the impact that it will have. It's beyond our capacity in this patch, but I do know that we're all certainly raising that issue in other forums, and part of this is to share that with a broader audience as well. So thanks for the question.
Kim, I could just add on top of that, it's a significant risk for consumers to lose talented, skilled staff who can support people's mental health, and to find themselves with something that looks or feels something quite different. So, a huge concern for consumers about what's the effect of the market driving what people be able to access in the NDIS space.
Thanks, Neil. Oh, sorry, Sue, I was just going to cut you off because David's nodding his head furiously over there and would like to make a comment.
Well, I was just going to say, my understanding is in the HACC program that the dollar per hour is significantly lower in the allocations in other states than it is here. That's a problem already, before we even start any other conversation. People will walk out and find other professions.
And as if to add to that, certainly the unit price for services under the NDIS assumes that everyone in Victoria who's in the sector is on the Modern Award. Now, our members basically and their staff are covered by 5 different industrial instruments in Victoria alone. We're a bit of an outlier in that regard. Many of the other states are almost exclusively working on the Modern Award. Suffice it to say that the Modern Award is a more frugal industrial instrument than some of the other instruments in the sector, and so that's got implications not only for the amount of the size of the wage that people in the sector may receive under the NDIS, but at least as importantly, the types of services that can be offered for the price under the NDIS. And certainly we're continuing to have what I hope are constructive discussions between our National Office and the NDIA around the issue of service pricing, and in the context of the question, it should be said that service pricing labour costs rather represent about 80% of any unit price. So it's a significant and ongoing issue that we would say has to be resolved as soon as possible.
And one of the things, I guess, that we do have in our favour is that we do have on this stage a group of panellists who are working together, who have individually a lot of voice in terms of their advocacy work, but collectively can have even greater voice around these emerging and unintended consequences. And I think you're right to point out that we should be thinking about that, and certainly the workforce development aspects is certainly front and central of our thinking around the projects that Kim described, around how we can both advocate for and skill a sector in this new environment. So I think that is within scope of this panel. I just wanted to add that point.
Yeah, I'd just like to say that this isn't a new problem in the disability sector. Support workers on the ground not so long ago were paid $13 an hour. Sometimes under the 24-hour model, people were paid $10 an hour. So the most important relationship with a person with a disability is the support worker. It's that person that negotiates with the person with a disability, and if they're highly skilled and that they don't bring in their own views and they're open-ended in those conversations, you get the best result. So it's really critical that support workers that work with people with disability are well paid, and this has been a common problem in the past. We think that the NDIA needs to address this problem. We think that the way that it gets addressed is that people with disability are allocated money under their package, and that there's some negotiation to pay support workers more and maybe trade off some of the hours. But it would be also critical that some of those models moved and that we have more community inclusion. We wouldn't want to see a situation where more money went into wages without some direct work in terms of those models.
Do we have any more questions?
Hi, thank you to all. It's been a fantastic afternoon. My name is Natasha Carleso and I'm from CoHealth, leading the Consumer Care Leadership Group and Service Purchasing. Spent years in allied health, and I'm very passionate about the integrated approach to care. And clearly lots of people with disability have many chronic conditions, and of course the additional aspect of having a mental health illness increases obviously the mortality rate. And I guess we've spent years of working together on how we can actually integrate our services better and how we can coordinate care. I'm interested to know what sort of thoughts have been given in terms of the coordinated approach to care, because clearly on one side consumers are given that choice of what sort of services they can get, but I'm also wanting to know then how those services are going to communicate to ensure that we've got coordinated care.
Who would like to take this question?
Give that woman a logie. She just found another elephant in the room.
Okay. Look, I'll kick it off. In the ethnic sector, new business models are needed. And you know, probably you can see the difficulty with answering this question because people haven't got the models. People are looking at innovative models, new models, but mergers is, you know, that sort of thing is the future, I think.
I think from our perspective, you've hit the nail on the head. I think that's a $1 million question. For myself, I'm a migrant and I've only been in the not-for-profit sector for 5 years, before that in health, and I think that's the issue. While we've got a federal and a state government battling each other, different parties, different policies, whilst we've got so many different players in the health community and not-for-profit sectors, I think that's an issue. We don't collaborate, we don't do it well. This panel has been the first really collaborative panel that I've worked on in my whole career. Since 1987 when I qualified. So, you know, this is the first time that we've actually got a number of organisations to work properly together, to collaborate and communicate and educate each other for our clients and consumers. This is the first time this has ever happened in my knowledge. I don't know about others, but I think we just need to lead the way. We need to be role models. We need to be more collaborative. We need to be talking to each other, and we need to stop looking at our backyards and protecting our own territories. I think there's a lot of that going on at the moment. And again, I think this reform agenda is making us even more competitive. So because we all want to stay alive and be viable, we're all protecting our patch. And the government is making us do that at the moment with competitive tendering and etc. So I don't have the answer. I can see it's just going to be a continuing problem until we can get some proper policy and some aligned policy on the table. And I think that as CEO, that's my role.
I know that CoHealth have an excellent care coordination model, and I'm talking about that at a client level, and I'm wondering if your question was actually partly at that client level. I think it is one of the big risks when you disrupt a service system that has come to find its own kind of workarounds, that you need to make sure that you're not creating silos and that you're creating capacity for workers to work together. I don't think that it's articulated nearly well enough in any of the current reforms. So I think that many of us have had odd sort of otherworldly experiences where we've had people frantically writing on whiteboards and showing us how silos were going to be broken down, but our practice and our gut told us that actually the silos are being reinforced. So I think those of us who understand care coordination and have good models, we just have to keep talking about them. We've got to keep banging on about it because we're going to have to build that in. We're going to have to find ways to wrap what people need around them and be give the best to the person, not give them siloed, crappy services, but give them the best we can give them. So keep asking everywhere you go. Just go, oh, hi, I'm the lady who asks about care coordination. How can we do that better? Go for it.
I think actually the fact that we're all giving you a bit of a shade of grey here in terms of the next steps. I actually think it actually represents an opportunity. I think it would be wrong to assume that the Commonwealth and the state governments have got it all sorted in terms of how it's going to work. I'm not suggesting that you do, but insofar as there is a lot of ambiguity and grey as to how these policies will be delivered in their implementation, I think there's an opportunity for the sector to actually be putting propositions as to how it could look, how it may work based upon the experience that, the long experience that people have had in the sector. The bilaterals, for the purpose of the NDIS, the bilateral agreements make reference to the role of the NDIA, for example, in terms of ensuring that governments basically continue to deliver mainstream services, as well as whilst the NDIA, through the NDIS, is delivering specialist disability services. What the bilaterals don't say is how the NDIA is going to do that. And that may have a lot to do with the fact that the agency is in fact a Commonwealth entity and that most of the mainstream services are being funded by and provided through state governments. So we're in a challenging space, but it's one that we may be able to take advantage of if we have good ideas as to how these issues which are unresolved can be resolved.
Thanks, David. Oh, sorry, Neil, we've got, please respond, and we've got one more question.
Going on a tangent here, but just the idea of a reform that sort of promotes choice and control for consumers, but that is driven by market forces, can be uneasy bedfellows at the best of the time. And I suppose a concern that I have personally is that this is cost cutting by stealth, and that I think it needs to be acknowledged that there needs to be kind of addressed that's like quality services, well-trained staff costs money, and it's not predicated on who can provide that at the cheapest price.
Thanks, Keith. One more. We've only got time for one more question, but the panel is free after the session, I hope. Go ahead.
My name's Nolene Tunney. I'm from the Victorian Aboriginal Community Controlled Health Organisation. I'd like to thank very much the panellists this afternoon. It's been a fascinating discussion and great food for thought. I'd particularly like to commend the tenacity of Kylie and the valorous work of her advocate. But I have a question, and it's about 2 centimetres to the left of the previous one, and it's around systems interfaces. So coordination, as far as I can see it, is the wrapping around of services at an individual level. But we've had, I think, the case study that Kylie placed before us, throws up really big issues around systems interfaces, and we have representatives from mental health that has a disability focus and a health aspect. We've got aged care. And we've been asking, certainly in aged care for a long time, around, well, okay, now that aged care is out of health, it used to be at federal level Department of Health and Ageing, and there wasn't a great interface between those systems, and now it's out on its own, or out into social services, and there appears to be scope for an even worse interface. Is anyone, or is everyone on the panel prepared to comment around work that has been done or is being proposed to address those systems interfaces so that we won't have 1,000 or 1 million amplifications of what Kylie has been going through, because every single damn client who shows up at the front door is told, no, that's health, this is disability.
Some years ago, I had the suggestion that we shouldn't have an aged care program, we should have an NDIS for people who needed support and disabilities. I was told to wash my mouth out because that would kill the NDIS, because it would be such a big amount of money. The only reason people receive support services when they're older is because they have a disability or ill health. So it doesn't we shouldn't have an age barrier. So that is something that I continue to raise, for want or not. But the integration of the systems is something I think a lot of us think about, talk about in some degrees, but whether it will ever happen, I know someone said to me the new Minister for Ageing at the federal level is the new kid on the block, is now in Cabinet and has the biggest budget of anybody. And does he know anything about ageing? Let's hope he does. But to then say to him, okay, talk with your mates about NDIS and let's see if we can integrate some systems. I know in Victoria, one of the issues we have at the moment is HAC and the rest of the aged care reform is different here because we've stood out, but it's going on the rest of the world of Australia without a lot of attention to us. And when I talk to my federal colleagues, they know, no, it's great, it's so much better than we had. And I go, yeah, but it's not even near what we've got and we may lose. So there's a bit of a mismatch already just in ageing in this country. So that's another dilemma. But one of the things at the Victorian level is even the previous minister was the Minister for Ageing and Health, and he didn't recognise the problem we were going to have with health once the HAC system changed. But, there's some millions of dollars disappearing out of the health support budget because of this change, and no one's even mentioned that yet. So I'm actually not optimistic.
I think I should be fair and note that this current government in Victoria is certainly very articulate and committed to this idea of joining things up at a policy level. So yeah, like you, let's all cross our fingers, let's hold them to account. So let's say they've started that conversation. So we should note that and see where that goes, because not everybody's willing to. The other sort of red herring I want to throw in, I don't want to sound like Pollyanna, but I think David touched on it a bit, saying that we're at the beginning of this journey, and we're at the beginning of really quite revolutionary change in how we deliver across a whole range of community sector organisations. The NDIS is really interesting to me. It terrifies me. I like it. I'm excited. I'm frightened. I'm everything by the NDIS. But the insurance part of it really intrigues me as to how that will start to unfold. Not now, not 2 years, 3 years, 4 years, but in 10 years. What will that insurance bit do? And I can't help but think of the work that TAC did in Victoria to reduce the road toll. So they started a really quite dramatic range of public sector campaigns and initiatives to get the road toll down, because they realised if they got the road toll down, they got their costs down. Yeah? I'm sure they had many other altruistic reasons, but really from an insurance point of view, that drove their behaviour. And I believe that the insurance element of the NDIS will drive behaviour and has some opportunities. I, like Neil, would be really disturbed if it drove costs down, but I think I probably am Pollyanna. No, I don't think it's it. I think it's realistic that they will seek to deliver on the public good and in a cost-effective way, and that will drive many of these things that we're worried about to come into the conversation. I hope I live long enough to see it.